What is public health? Public health is the science and practice of protecting and improving the health of communities through education, policy development, and research. It encompasses a wide range of topics, including disease prevention, health promotion, epidemiology, environmental health, and healthcare systems. Public health professionals work to prevent illness and injury, promote healthy behaviors, and ensure that everyone has access to the healthcare they need. Public health efforts are aimed at improving the overall health and well-being of populations, rather than just treating individual patients. This includes addressing social determinants of health, such as poverty and access to education, as well as developing policies and programs that promote healthy behaviors and environments. Some examples of public health initiatives include vaccination programs, public education campaigns on healthy living, and research on the causes and spread of diseases. Public health professionals also work to monitor and respond to outbreaks of infectious diseases, and to ensure that healthcare systems are able to meet the needs of the communities they serve. Public health WHO. Public health refers to all organized measures, whether public or private, to prevent diseases, promote and prolong life among the population as a whole. Its activities aim to provide conditions in which people can focus on entire population, not on individual patients or disease. Thus, public health is concerned with total system and not only education of particular disease. C.E.A. Winslow, a former professor at Yale University, defined public health as the science and art of preventing disease, prolonging life and promoting health and efficiency through organized community effort for the sanitation of the environment, the control of communicable diseases, the education of individual and personal hygiene, the organization of medical and nursing services for early diagnosis and preventive treatment of disease, the development of social machinery to ensure everyone a standard of living adequate for the maintenance of health. Goals of public health. The main goals of public health are: promote health, prevention of illnesses and diseases, prolonging life, encouraging people for early detection and treatment, control of epidemics. The work domains of public health as depicted from the various definition of public health. Thematic domain of public health. Nutrition. Nutrition is the science of food, the process of providing or obtaining the food necessary for health, growth and development. Human nutrition can be defined as the science of food and how it is related to health. It involves the processes where all people, all living organisms, receive and process the nutrients essentials for life. The process of taking in food and using it for growth, metabolism and repair. Nutritional stages are ingestion, digestion, absorption, transport, assimilation, and excretion. There are 6 main nutritional components of food, which are carbohydrate, protein, fats, vitamins, minerals, and water. Calcium, potassium, dietary fiber and vitamins are considered dietary components of public health concern. Greater than to assess socioeconomic differences in the 3 components of nutrition knowledge, i.e. knowledge of I. The relationship between disease and diet. 2. Nutrients content of food. 3. Dietary guideline recommendation. Nutrition is how food affects the health of the body. Food is essential, it provides vital nutrient for survival and helps the body function and stay healthy. 2. Body movement. A change in protein is termed as a movement. In our human body, it takes place when there is any motion of a population or a combination of body parts. The way the body moves within space or while stationary. The 3 specific components include: I. Locomotor movements. Movements that propel the mover around an area. 2. Manipulative movements. Movements in which the hands or feet control objects such as pen or ball. 3. Axial movements. Movements that are stationary or that do not propel the mover around an area. Purpose of movements. Movements is essential for every health aspects, such as ensure use of all body part, assist with internal movements, maintaining body weight, mood and stress reduction, prevents cardiovascular diseases, immune function, improve strength of body, sleep, bone density, help in digestion. 3. Environmental health. Environmental health is a branch of public health that focuses on the relationship between people and their environment, promotes human health and well-being and fosters healthy and safe communities. Environmental health is a key part of any comprehensive public health system. Components of environmental health. A. Housing quality. B. Recreation area. C. Noise control. D. Water quality and air quality. E. Hazardous waste control / solid waste management. F. Radiation protection. G. Food protection. H. Vector control. The main purpose of environmental health is to promote health, prevent disease, morbidity caused due to contaminated air and water and food. 4. Reproductive health. Reproductive health is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity, in all matters relating to the reproductive system and to its function and processes. Components of reproductive health. A. Safe motherhood. B. Family planning. C. Child health. D. Prevention and management of complication of absorption. E. Reproductive tract infection, RTI. F. Sexually transmitted infections, STI. G. Prevention and management of subfertility. H. Adolescents' reproductive health. I. Problem of elderly women. J. Gender-based violence. The main purpose of reproductive health implies that people are able to have a satisfying and safe sex life and that they have the capability to reproduce and freedom to decide if, when, and how often to do so. 5. Child health. Child health is a state of physical, mental, intellectual, social and emotional well-being and not merely the absence of disease or infirmity. Healthy children live in families, environment and communities that provide them with the opportunities to reach their fullest developmental potential. Components of child health. A. Immunization coverage, prevents from 6 killers diseases, measles, tetanus, pertussis, diphtheria, poliomyelitis, tuberculosis. B. Growth monitoring. C. Nutrition, exclusive breastfeeding, demand feeding, complementary and supplementary feeding. D. Complete breastfeeding for 6 months. 6. Family planning. Family planning refers to the use of various methods of fertility control that will help individuals, men and women, or couples to have the numbers of children they want and when they want in order to assure the well-being of children and parents. An expert committee of the WHO defined family planning as a way of thinking and living that is adopted voluntarily, upon the basis of knowledge, attitudes and responsive decisions by individuals and couples in order to promote the health and welfare of the family group and thus contribute effectively to the social development of a country. Components of family planning. A. Service delivery. B. Counseling. C. Capacity building. 7. Occupational health. Occupational health is an area of work in public health to promote and maintain highest of physical, mental, and social well-being of work as in all occupation. Occupational health seeks to promote and maintain the health and well-being of employees, with the aim of ensuring a positive relationship between an employee's work and health. The placing and maintenance of the worker in an occupational environment adapted to his physiological and psychological equipment, and to summarize, the adaptation of work and to man and of each man to his job. Components of occupational health. A. Occupational medicine. B. Industrial hygiene and safety. C. Industrial welfare services. Conclusion. Overall, public health is a multidisciplinary field that plays a crucial role in promoting and protecting the health and well-being of communities around the world.